Hello and welcome to TLC Eye Care. My name is Dr. Erica Person and I'm a board-certified comprehensive ophthalmologist and a fellow of the American Academy of Ophthalmology. I'm going to be talking to you today about cataract surgery. I've performed hundreds of cataract surgeries in addition to spending 3 years teaching both the art and the science of cataract surgery to residents before joining the excellent surgical team here at TLC. Cataract surgery is a straightforward procedure and we'll start with the anatomy of the eye. The cornea is the clear front part of the eye. Behind that is the iris. Through the pupil in the center of the eye is where the natural lens has become cloudy and made it difficult for you to see. If we think of the eye from front to back, the cornea bulges forward off the eye a little bit. The iris comes more or less straight across, and then the natural lens lives behind the iris and is tethered to the side. In order to do cataract surgery, I make a very small incision on the cornea, approximately 1/8 of an inch, and it corresponds right here through the cornea. The second step is to make a careful opening in the front of the cataract so I can insert a tool, which then uses ultrasound to break up the cataract and suck it out like a vacuum. Without the natural lens in the eye, your eye would not be able to focus light, and so we need to implant a clear acrylic lens, which then goes right back in where the original cataract came out from. There are multiple choices on the lens implant. The first choice is a standard lens. This is the most popular choice because it is covered by all insurance companies, and it helps patients see clearly to drive at distance 80 to 90% of the time. All of these patients will need reading glasses to help see up close, and especially for fine print. For patients who have astigmatism, there are two options. The first is the LensX laser. For a moderate amount of astigmatism, the LensX laser will reduce the astigmatism on the surface of the cornea, and it also has the additional benefit of softening the lens, which increases the recovery time so that you see clearly sooner. The alternative to the LensX laser is a toric lens, which works wonderful for patients who have a higher amount of astigmatism. Patients who use these lenses may still need reading glasses for up close, but it helps us achieve a greater clarity at distance. For patients who truly want to be free of glasses, we do offer the multifocal lens. And this is like implanting a no-line bifocal into the eye. This is great for patients who want to be free of glasses 90 to 95% of their day, although they may find that they still need reading glasses for especially small print, including things like phone books, medicine bottles, and fine print Bibles. The risks, benefits, and alternatives of cataract surgery. Like most surgery, bleeding and infection are common risks. The risk of bleeding with cataract surgery is so low that for my patients who are on blood thinners, even Coumadin, I recommend they continue their blood thinners. Most patients after cataract surgery will have a red spot on the white part of their eye. It is possible to have bleeding inside or behind the eye, although this is extremely rare. The possibility of having a heart attack or a stroke coming off of a blood thinner far outweighs the risk of bleeding. If you're uncomfortable with this, please feel free to talk to your primary doctor, but I do recommend staying on your blood thinners. The risk of infection is very low. It is 1 in 1,000 to 1 in 1,500 cataract cases, depending on the publication. Even though this risk of infection is low, we still take it very seriously because it can cause a permanent decrease in vision. This is why we have our patients start an antibiotic eye drop before the surgery and continue it for a full week after the surgery. This is also why I prefer to perform my surgeries at a surgery center that specializes in cataracts, because this is also known to decrease the risk of infection. The pressure can also fluctuate or increase after cataract surgery. This is usually not a major problem for patients, as we just put them on an additional drop to lower the pressure during the immediate post-operative period. I also put on here need for more surgery. And that can be if a piece of the cataract breaks off and falls back into the eye and we have to fish it out with a second surgery, or this can also be from complications with the retina at the time of surgery or in the immediate post-op period. If you are at higher risk for any of these particular complications, I will let you know. In general, the risks for cataract surgery for a serious complication are about 1 to 2%. We're very fortunate that cataract surgery is a safe and effective surgery, and if you have any questions, please let me know. The benefits of cataract surgery are to improve your vision, decrease your glare, and help you see better, preferably without glasses. And we'll talk a little bit further about that when I review the lens choices when you come to see me in the room. The alternatives to doing cataract surgery are to continue with glasses, maybe update the glasses prescription to help you see better, and then revisit possibly doing cataract surgery at another time in the future. Cataract surgery is elective surgery, so it does not need to be done on an emergent basis. It can be done when it works out well for you, your health, and for your family. If you have any questions about cataract surgery, the lens choices, please feel free to ask me or any of the staff. We always try to answer all of your questions before the day of surgery and make sure that you feel comfortable with the procedure. Thank you very much, and I look forward to meeting you.
Cataract surgery and/or implantation of intraocular lens IOL consent. What is a cataract and how is it treated?